Thankfully, with respect to our COVID-19 situation, things have been really stable for the last 3 weeks. We are still hovering between 150 and 200 cases, which has been the case again for the last 3 weeks. And our hospitalizations have been down to fewer than 10. So that's really great news. I think all of us are waiting to see what happens with the latest variant of Omicron, the BA2. And looking at the data that were released today, it looks like just over 50% of the cases of COVID in Virginia, in this region, are attributable to BA2. So just to keep that in mind, that is the latest concern for variants, and it is more transmissible than the previous variant of Omicron. So we're looking at what that impact, what impact that might have on our community. We do expect that we may see some increase in cases as is being seen across Europe and in some parts of the United States. So we're keeping our eye on that. I think that the really important message, we have low levels of COVID-19 activity in our communities. All of our jurisdictions in the Roanoke City Alleghany Health Districts are in green right now. Looking at our numbers for this week so far, we expect that to continue when CDC releases its new community levels on Thursday. But we continue to watch for our trends, continue to anticipate that what is happening in Europe tends to precede us by a few weeks. And so I think that the message here that is really important, that we've been talking about for well over a year, is that the vaccines are safe and effective. And for anyone who is concerned about the more transmissible BA2, we would certainly recommend that they ensure that they are up to date on their vaccines. And with that, I will take any questions that you may have.
Looks like there's one in the chat from Jean Morano.
Sorry, I didn't have my chat up. I usually do. So what do you think about the possible fourth dose? Certainly, we're waiting, as always, we're waiting to see what the FDA and then the Advisory Committee on Immunization Practices, how they weigh in on that. We are anticipating that a fourth dose will become available, will be approved sometime in the near future. Some people have said as early as today, but we'll just have to wait and see, and as always, be and based on those directions, we will take the next course. So I think that what we do know, or what I should say, what we do know at this point, is that both natural immunity and vaccine immunity do wane over time, and that if a fourth dose is recommended, which we anticipate, we would strongly encourage those people who are eligible to ensure that they're up to date on their vaccines. What we've learned over the last year, 15 months of having vaccine more available is that we're going to need to continue to be flexible as our data emerge. We know that the vaccines are safe. We know that they're effective at reducing hospitalizations and deaths associated with COVID-19. We also know that they're not the perfect tool, but they are an incredibly important tool. So that, and if our community transmission levels go up again, which we think may happen, we need to be careful about that. We'll just have to take it day by day and week by week and make our recommendations based on the best data that is currently available. What type of grade would I give VDH now for how it handled the pandemic, with all the ups and downs, changes, lessons learned, better prepared? That's a great question. There's no doubt in my mind that we are far better prepared today than we were 2.5 years ago before this started. We have really seen community partnerships just blossom in ways that I think are really reassuring. What this pandemic has taught us is that we all need to work together. And when there is a threat anywhere in the world, there is a threat in our backyard. And so we need to be prepared. We need to constantly keep our communication open so that when the next surge comes, we can work together to mitigate that and minimize the impact that it has. I've just been so honored to work with such a wide range of community partners, from our first responders to our hospital partners, to our outpatient partners, to our community-based organizations, our faith-based leaders, so many different partners. And what I know is that we are better prepared today, both in terms of the partnerships, in terms of our technology. We have vaccine, we know how to distribute it. In terms of our technology, we have newsletters, we have so many other tools available to us, social media. Are we ever going to be 100% prepared? No. And I think that we need to always know that there's more that we can do. And so our job is to keep doing it, even when we're in areas of low level transmission, as we are today. So we're continuing to do what we do, and we'll continue to do that. So in terms of how did VDH do, I think we've done really well, given an incredibly challenging 2 years. Can we do better? Yes. Should we do better? Yes. And that's what we're trying to do every single day, is to do a little bit better. There's been some talk about long COVID. Senator Kaine is pushing to create a database for people experiencing long COVID symptoms or long COVID to get help. What are some common symptoms? So the challenge with long COVID is that we don't have great data on it. And so, I don't want to overstate it too much. What we do know is that it affects far too many people, and that there is a very, very wide range of consequences to long COVID. So you hear about people who have chronic lung problems, someone who may have had asthma but was very well treated or well controlled prior to long COVID or prior to COVID, and now has more severe asthma. Certainly, we know that there's a neurologic impact. There are people who experience this brain fog, but this really challenges in their neurologic functioning. There's just such a wide range, and I think that the important thing for everyone is that we get good data so that we can have a better way of answering that question, if that makes sense. Are there any questions that you'd like to ask?
Hi, Dr. Morrow. Can you hear me?
Yes, I can. Thank you.
Hey, I asked this question of your cohort in the New River Valley. Sorry, you probably can't see me. There you go. Yesterday. Now that obviously surveillance is going to continue for COVID, but we're not, obviously where we were at the height. So the energy that was being directed to sort of this all hands on deck approach with COVID, how is that going to be redirected into normal operations? Essentially, what are among the other highest priority items for your health district that your folks are going to maybe pivot to now that COVID isn't fully demanding of the attention like it was?
Yeah, not on my end. So that's a great question. And I think that one of the things that is really important for us to do as a local health department is let our community and let our data drive our actions. And what do I mean by that? What we know is disproportionately hurting us right now. We know that we have an ongoing hepatitis A outbreak, and we're currently up to about 55 cases of hepatitis A in the last few months, not associated with our fall restaurant-associated outbreak. This is a separate outbreak that's disproportionately impacting our population who use injection drugs. So we have been working hard with our community partners to try to get the information out there, to try to get vaccine out there. This is a vaccine preventable disease, and we want to make sure that we're doing everything we can to protect individuals who are at increased risk of getting hepatitis A. In addition, I think that one of what we've been doing is really taking a hard look at our data. We know that substance use disorder is a challenge across the country, but we are disproportionately impacted by substance use disorder in the Roanoke Valley. And that's something that is really important to us, that we look at what systems we have in place, how we build our partnerships, working with, again, our first responders, law enforcement, to help us identify where we need to put some energy in terms of education outreach and try to get individuals who have substance use disorder the help that they need to address this insidious health concern. But I think that for all of us here at the Roanoke City Alleghany Health Districts, we have this renewed energy, this renewed passion to really look at what we call our community health assessment, our community health improvement plan, work with our community partners to see what they think is the most important. What do the people that we serve think are the most important issues for us to address? And then how do we develop systems to address those concerns? So we need to be driven both by our data and by the priorities from our community members themselves.
And then along with that, would you be able to identify maybe at least three, I don't want to use the words benefits because I don't, I'm sure we all wish this pandemic had never happened, but some of the ways that your health district pivoted to address the pandemic that will continue to stick around, any ways that you are better for having pushed through the pandemic as a health district?
Yeah, so there are several ways that I think we're better. One, I cannot overstate the importance of our community partnerships. So that's, to me, the most obvious, is really rebuilding built some trust for the last 2 years. The second thing is that it has provided us an opportunity through COVID funding to get some amazing contract workers in place during COVID. And we've been able to translate some of those wonderful individuals' contract positions into ongoing public health full-time positions here at the health department. And so one of the things that I think we did well, that we need to continue to do well, is to look at our community through the health equity lens. And with that, we've been able to identify some incredible people to help us in our journey to address health equity. And so part of it is just identifying and those public health professionals who are passionate, and COVID opened the door to them coming in and becoming part of our VDH family here. And then I think that the third thing that we are, and that I just addressed, and the other question, or the other part of attracting a workforce that's a dedicated, competent, compassionate workforce, is that we really have changed our lens to a lens of health equity. And COVID has helped us bring it to the forefront. We are now having trainings where we're doing health equity training, trauma-informed training, compassion, COVID opened to us getting not only the infrastructure in place that I think will help us better serve our community, but getting access to training, getting access to a skill set and knowledge base that will help us serve our community regardless of the threats that we face. So to sort of synthesize that, partnerships, a highly dedicated, competent workforce, and health equity training, and just a change in our perspective. Those would be the top three. Thanks, Leanna. Are there any other questions? Thanks, Jean. Yeah, and one of the things that, just we can go offline, or we can just keep it on, but one of the things that that we were just talking about is how do we continue this partnership with our media. And I think that Christy and I would both like to continue to have bi-weekly updates. We won't necessarily call them COVID updates, but we can share with you what's going on with respect to our hepatitis A outbreak or any other initiatives that we have. So if you are interested, we're certainly interested in keeping these bi-weekly media briefings ongoing so that we can continue this relationship and continue to work together to improve the public's health. Oh, great. So I'm seeing some positive responses. All right. Well, we will continue to do them then. Any other questions, concerns, anything else, any information that we can get to you? All right. Well, thanks as always for everything that you do, and I look forward to talking with you again in a couple of weeks.
Yes, that sounds good. I will get this video out, and just for the media, just for a heads up, we'll be working more on getting folks caught up on immunizations of all types. We'll be talking about that more, and we also will be working in conjunction with some of the national highlight weeks. Next week is National Public Health Week. The week after that is a focus on sexually transmitted diseases. And so we can talk with you about any story ideas that might result from that, as well as keep you up to date. All right. Well, with that, thank you all. Have a great day.
Thank you. Bye-bye.